In the last video, we talked about imaging procedures and when they are useful. We have briefly looked at the topic of medication. In today's video, we want to take a closer look at the topic of pharmaceuticals and answer the question of when they make sense and when they don't. Everyone probably knows the situation. You have knee, back, or other physical complaints. If they don't go away on their own, you usually go to the doctor. They will usually prescribe pain medication or give you a cortisone injection. What exactly happened? Was the cause of the disease found? Or were the symptoms suppressed once again? As we learned in the last video, a detailed examination is required to find out where the symptoms are coming from. Unfortunately, this examination is not possible with conventional medical equipment, as only the current condition of the joint is determined here. The years of history are not taken into account. It is therefore important to determine the exact cause of the pain before administering medication. The physical discomfort that we feel at first should first of all be understood as a kind of warning signal. The pain helps us to keep the joint still and avoid unfavorable movements. This is a kind of protective mechanism of the body. It tells us that something is wrong and that we should take care of it. If we are driving our car and suddenly a red light comes on signaling that we should drive to the garage immediately, nobody would think of braking or switching off the red light that indicates danger. But this is exactly the normal procedure in conventional medicine. Patients come to the practice with pain, and these warning signals from the body are anesthetized with medication. The cause of the problem has not yet been found, but as long as the pain is numb, many people are unfortunately satisfied with it. Of course, it is only a matter of time before other complaints arise. Whether these can then still be numbed with medication and injections is questionable. Our health is the greatest asset we have, but unfortunately, we only realize this when it is lost. We should therefore listen to our body's warning signals and not suppress them. So let's summarize. Pain medication should never be a permanent solution. It is much more important to find out where the cause of the pain lies. If you are interested in learning more about the anatomy of the human body, you can visit our channel. Here, we try to give people basic knowledge about anatomy. In this way, people have the opportunity to help themselves and others. We hope you enjoyed the video and look forward to seeing you again in the next episode.